Hello and welcome back to Silvia's Health Hints for expats, tourists and abroad students, again from Florence. Last week I talked about, I discussed which medications you should take with you while traveling. And the last week it was all medications for adults, and I wanted to add this video to give you some recommendations if you're traveling with children. Some things will be the same, so I will make it much shorter and not explain everything again. Paracetamol for fever and pain. I repeat that paracetamol is very efficient on fever, much more than ibuprofen. So if the fever is high, it's a good drug to give. Then ibuprofen for fever, pain and inflammation. The difference between paracetamol and ibuprofen is that paracetamol works better on fever but is not anti-inflammatory, while ibuprofen is anti-inflammatory. If your child has a high fever which is not going down with ibuprofen, which you gave because you wanted to fight the inflammation, you can add paracetamol, which is more effective on fever than ibuprofen. They can be taken together. Then you have also more possibilities to give more often, and you can control the fever much better. Antibiotics, of course, like for the adults, for bacterial infections, any kind of infections, airways, like common cold, urinary tract infections, soft tissue infections after injuries, skin infections after insect bites, and also here the best one with the widest spectrum of bacteria is amoxicillin with clavulanic acid. And also here, in case of a strep test, which resulted positive for strep A, 10 days instead of 6 days. The same like for the adults, amoxicillin is a penicillin. There are also children who are allergic to penicillin. So if there's a case of penicillin allergy, don't give amoxicillin to your child. Another antibiotic you can take with you is azithromycin. Which works on a lot of different bacterial infections, including gastrointestinal infections like diarrheas. Antihistamine for itching and allergies, steroids for allergies, and in children there is an indication. For example, whooping cough or a very dry cough. Normally we give steroids. And also here the same like for the adults, steroids are slow. If you have a severe allergic reaction, give in first place antihistamine. If the allergy is known, some people have, for example, also adrenaline shots they know to use and to give to themselves or to the children. Steroids you can give then, because they have a long-lasting effect and they can help with a secondary or late reaction. But in the beginning, when you have a severe reaction you want to control, give antihistamines. Probiotics, the same thing like for the adults. This is for the intestinal flora. This is to have better immune defenses. It's for traveler's diarrhea, for food poisoning, and also here, also for children, exists carbon tablets, which you give if, for example, the probiotic was not helping enough, and the diarrhea persists for days and days and days, which doesn't make sense anymore. Then you can give to the child carbon tablets. For the nausea in children, normally we give metoclopramide. This is at least like this in Italy. There are other countries which have also other drugs, but in Italy the only one you can is authorized for children is metoclopramide. I hope your children will stay healthy and you will have fun and enjoy your vacations and see a lot of nice places. I thank you very much for watching also this video, and we see each other next week. Thank you.